Hello, welcome to the Senior Spotlight. I'm Mary Cordova with Concierge Care Advisors, and this is Senior Spotlight number 17. We're going to talk about our advisory board today. Today, I am here with Dr. Brian Ferris and Linda Marzano and Shane Bray. And we actually are missing our doctor, Alex de Moraes, but he will actually be with us on the next spotlight. So, welcome, you guys. Thank you for coming to the spotlight tonight.
Thanks again.
Thanks for having us.
Absolutely. So, as you guys know, but not everyone else knows, we came up with an advisory board. This is something that Mark Lilly absolutely wanted to do from the time we invented this company 15 years ago. But both of our doctors absolutely have been wonderful to be have on this board. But to have now Linda and Shane, we're so grateful to have you and your backgrounds coming from all diverse backgrounds has been really helpful for us to look at our vision going forward for the next journey of people aging. So thank you so much again, Linda and Shane, our newest advisory board members. Really excited to have you here. So tonight we're going to talk about a little bit about your guys' backgrounds. And doctor, we all know about your background, but we'd love to hear it again. And of course, we'll share a little bit about Dr. De Moraes as well. So if we can start with our newest member, which will be Linda, and obviously ladies first. So we'll get into a little bit about your healthcare executive background, your advocacy for seniors and patients, and then we'll get into our other advisory boards as well. So welcome, Linda.
Thank you. Thank you for having me.
Of course.
I'm excited to be part of the team. I started my healthcare journey many years ago as a registered nurse, and I have always felt very strongly about patient care and have felt that being a nurse was more of a calling than just a job. And I had spent about 10 years doing clinical work and continued to progress in my career all the way through being the chief executive officer for a multi-specialty group practice and also the CEO of a capitated health plan for retired military. So I did a lot of work in DC around advocacy for retired military and their active duty family members. I also became the senior vice president of value-based care for the Providence Health System, looking at risk-based contracts and the care model needed to transition from a fee-for-service environment to more value-based care, which would bring more value to the patients and the providers
Absolutely.
and improve outcomes and save money. And that's something I'm passionate about because everyone should have access to quality health care and be healthy and help be part of the community. And all of the healthcare organizations that we work with, whether it's public health or other supporting organizations or non-traditional partners in healthcare, I feel we all come together to bring quality care to patients in our communities that we serve.
So important. The quality of care, the good outcomes that the patients and their families can see. And I do believe that nurses have a calling as well, much more than a job. So thank you again for being on our board, and we're so lucky to have you.
Thank you.
Shane, we'll go back to over to you and tell us a little bit about your background. I know you come a lot from the payer space, but would love to hear a little bit about your background and what you're doing on our board to bring value to not only the patients, but to their families and looking at their short and long-term goals on their finances, where they want to end up, all of those kind of things that we're creating. And you can share a little bit about that today as well.
Sure. So I guess similar to Linda, I started off as a nurse in the clinical field. Spent some time in med surg, ambulatory, emergency. Did that for about 14 years, and then made the transition from clinical to technology. Decided to make a bit of a career change. Went to engineering school, became a software engineer. Right out of engineering school, got started with a healthcare tech startup that went fantastically well. I won't bore everybody with the details there, but essentially it was really about creating a Medicare marketplace that brought in many of the Fortune 500 and 100 or so payers, many different plans, and it was really about helping seniors navigate the complexities of selecting health insurance products from Medicare Exchange, using an HRA mechanism as a way to pay for that. Spent about 14 years on that side, and then ended up in the payer space. Somewhat really never thought I'd be in health insurance. Spent 5 years at Blue Cross Blue Shield, and have now transitioned out of the payer space and really focused more on healthcare tech, and spending a lot of time with Concierge Care Advisors, looking on what's next here.
So excited. I've learned something about you, Shane. I think a best kept secret that you're a nurse. I did not know that.
That's right.
So thank you for
Yeah,
sharing.
that's where I started.
So now I know your empathy and your passion and where it comes from.
That's right.
Thank you. Thank you for sharing. Dr. Brian Ferris, our leader, our vascular surgeon, would love to hear a little bit about your background and how you've been helping us as well.
Well, I'm delighted to be here, and we met, I think, about a year ago. I am a vascular surgeon, which when I trained, you became a general surgeon before you became a vascular surgeon, and I've been in practice, and I'd like to say that with a capital P, for over 20 years, because it wasn't just patient care, it was clinical research, it was participation in health networks, as well as hospital leadership. And over the last year, I've stepped out of clinical practice from my own wear and tear, and I'm doing more on the consulting and industry side, working with you all and other healthcare technology. I've got some experience in the device development world, but at the core, it's all about the patients, and that's what I really enjoy the most. And I learned a long time ago, and it's been reinforced through a lot of clinical practice, that patients do great when everything else is settled. And as a vascular surgeon, by definition, a large part of the practice is devoted to aging patients, senior patients. And so they're dealing with aging, Medicare, and everything else that comes from that. And what I learned long